Hello, my name is Genesis, and I am going to describe the next stop on your surgical journey, the recovery room. When your surgery is completed, your OR nurse and anesthesia provider will transport you to the recovery room on a stretcher. Guess what? That is right back where you started. A thorough report on your medical status will be given to your recovery room nurse as you are being reconnected to monitors. Your warming blanket will be reconnected to maintain your temperature. Your nurse will ensure that you are kept warm, safe, and comfortable at all times. The recovery room nurse will continuously monitor your heart rate, respirations, oxygen saturation, and blood pressure. Your recovery room nurse will assess your wound by checking the dressing and looking for any drainage that may be present. The goal is to keep the surgical site clean and dry. Your nurse will also assess any drains or tubes, such as Foley catheter, that you are likely to have and will measure any output collected in these devices. Your nurse will also ensure that your IV line is functioning properly and will administer your immediate postoperative IV antibiotics prescribed by your surgeon. Your sensation and pain are continuously assessed. Many patients having hip and knee replacement surgery have a spinal anesthetic which numbs you from the waist on down, as well as peripheral nerve catheters or peripheral nerve blocks. To determine the level of pain control you're receiving from the spinal anesthetic, the nurse will check your sensation using ice. Don't worry if you can't feel anything or can't move when asked to do so. This is normal and expected. The assessment will be repeated to identify when the spinal anesthetic is wearing off. It wears off from the top down, so your ability to wiggle your toes will be the last thing to take place. While the spinal anesthetic is still working, your peripheral nerve catheters will be connected to a pump to allow for a continuous infusion of local anesthetic. These are the catheters that the regional anesthesiologist placed in you before surgery to help manage your pain after surgery. We will teach you how the pump works and give you a button to push if you need an additional dose or medication. As the spinal anesthetic wears off, you will have more and more sensation. We use a pain scale to determine your pain level. We will ask you to rate your pain on a scale of 0 to 10. 0 means no pain, and 10 is the worst pain you could imagine. Your pain score will help us choose the best method of pain management at that particular time. Our team will do everything we can to help manage your pain. If you experience pain, please tell your nurse so he or she can ensure that your peripheral nerve catheters are working as intended. They may require additional medication to keep you comfortable. You will be asked to cough and breathe deeply. These actions are very important to help prevent complications such as pneumonias. We point these things out because after surgery, most people don't want to take deep breaths or cough because it hurts. We will manage your pain so that you can comfortably perform these very important functions. In the recovery room, there will be other patients around you recovering from various surgeries. Because of the close proximity and privacy issues, we do not allow visitation in the recovery room. If you are awake and feel up to it though, you may use our portable phone to call and talk with your family. We also have a volunteer liaison that will be making rounds and will update your family while you are in recovery. When you arrived in recovery, the bed board was notified that you needed a hospital room. You will not be discharged from the recovery room until you meet certain criteria and have been cleared by your anesthesiologist. When this time comes, your recovery room nurse will call the nurse on the hospital floor and give a thorough report of your medical status, including your history and details of the surgery you just had. A patient care technician or a nurse will take you to your room. They will use a ceiling lift to get you safely into your bed from the stretcher. I hope you found this information helpful. On behalf of the recovery room team, we thank you for allowing us to serve you and for putting your trust in us.